We're really blessed to have a legal team that looks at risk management as also reward management. You know, that it isn't all just about preventing bad things from happening. It's looking at what's the realistic possibility or probability of bad things happening, but also what's the upside. You know, what are the benefits? For Mayo Clinics, word of mouth has been, for more than 100 years, the way people have found out about us. You know, we don't do national television advertising. We don't do any national advertising, really. And so it's been the word of mouth of satisfied patients that's built our brand for 100 years. So having a legal team that looks at not just what are the bad things that could happen, but how does this contribute to the core way that people have found out about us for a century has been helpful. And we've managed it. We've said, you know, we look at if people are commenting as individuals telling their own stories. HIPAA doesn't prevent that. You know, I mean, people can tell their own stories. If they're talking about a family member, you know, then we de-identify and we go by, you know, first name, last initial or something like that, if they want to share their stories in that way. Or if it's a really compelling story and we want to actually have us upload some video, so where we're actually would be in the position of disclosing personal information about a patient, we get a consent form just as we do for TV interviews or other things. So it's just looking at it in and not just throwing up your hands and say, oh no, we can never do that. It's finding a way to make it work, not getting around HIPAA, but living within HIPAA and living within other, you know, rules and regulations.